What's really important for this network is to get focused on what makes a difference. Those could be small innovations, they could be larger scale innovations, but what's clear is it must be focused, it must be able to be applied, and the quicker it can be applied, the better.
The network priorities for me are that we actually see more collaboration between the GPs as commissioners and the secondary care functionality, if you like. You know, I see a lot of patients who come out of hospital confused about their medicines. So there's a lack of pathway joining up, if you like, within the NHS from secondary care to primary care. So for me, I'd just like to see that a bit more seamless, and it is an opportunity for pharmacy to make that transition for patients better.
This is an opening meeting today, and we're just talking about general principles, but the concept's absolutely right. The delivery is going to be the difficult bit.
One issue that we need to think about is what I'd call the kinetic dimension. The priorities right now will be different from the priorities in 1 or 2 years and the priorities 5 to 10 years down the line. And while we talk a lot about innovation in relation to start-up companies and so on, that's really quite a long timescale to be thinking about. There's also the question of what you do about the innovative work that's going on that can be reduced to practice in the much shorter term. So I think a top priority for the network early on is to identify the innovation going on in the region that already exists and see how best to put that into the NHS.
It's important that the research that is done and the innovation that's produced can be applied directly to the challenges which we face and can be applied quickly.
The one thing I take away today, and it's a slightly negative thing, but on our table, we were sitting with somebody in quite a senior role from the NHS, and I was stunned by how little he knew of my world. We were talking more about my world than his. I think if he'd turned the tables and talked about his world, he'd have been stunned at how little I knew about his world. So it's the lack of knowledge that I'll take away, I think.
Money is getting tighter, demands for healthcare are getting greater. We need to see things coming out of this network that we can make best use of with our providers as quickly as possible.
There is some positivity in the network. You can see it already in the contributors here, and there is obviously some key people who are in that network which I hope will be able to influence that evolution, if you like, of how we care better for the patient. So putting the patient first, as a number of people in the room did say earlier.